Good morning, Miss. We hope you are well. Together with my partner, Paula Jiménez, we will talk about Alzheimer's disease.
Alzheimer's disease is a progressive disorder that causes brain cells to waste away and die. Alzheimer's disease is the most common cause of dementia, a continual decline in thinking, behavioral, and social skills that impairs a person's ability to function independently. Symptoms. Memory loss indicates symptoms of Alzheimer's disease. One of the early signs of the disease is usually the difficulty to remember recent events or conversations. As the disease progresses, memory disturbance worsen and other symptoms develop. At first, the Alzheimer patient might be aware of difficulty remembering things and organizing thoughts. A family member or friends is more likely to notice worsening symptoms. Symptoms of Alzheimer at an early age. Changes in personality and behavior, such as depression, apathy, getting lost in familiar place, having troubles finding the right words to identify objects, expressing troubles, forgetting the names of family members and every object's difficulty concentrating amongst others.
Results. Scientists believe that in most people, Alzheimer's disease originates from a combination of genetic, environmental, and lifestyle factors that affect the brain over time. Risk factor. Age. Advancing age is the largest known risk factor for Alzheimer's disease. Alzheimer's disease is not part of normal aging, but as you get older, the chance of Alzheimer's disease developing Alzheimer's disease increases. Family history and genetics. The risk of Alzheimer's is slightly higher if a first-degree relative has the disease. Most of the genetic mechanisms of Alzheimer's in families are largely unexplained, and the genetic factors are likely complex. Sex. There seems to be little difference in risk between men and women, but in general, more women have the disease as they tend to live longer than men. Other risk factors: Down syndrome, past head trauma, poor sleep parents, lifestyle, and health, among others.
Preventions. Alzheimer's disease is not preventable disorder. However, several lifestyle risk factors for Alzheimer can be modified. By changing habits, you reduce the risk of developing the disease and other disorders that cause dementia, such as exercise regularity, eat a diet rich in fresh produce, healthy oils, and foods low in saturated fat. Follow treatments guidelines to control high blood pressures, diabetes, and high cholesterol. No smoking.
Diagnosis is a fundamental part of the diagnostic evaluation are the symptoms that the person manifests, as well as the information that a close family member or friend can provide about the symptoms and the effect they have on their daily life. In addition, the diagnosis of Alzheimer's disease is based on tests performed by the doctor related to the evaluation of memory and cognitive abilities. Tests at diagnostic physical exam usually include the following tests. Physical neurological examination. The doctor will perform a physical examination and will likely assess general neurological health by performing the following test. Reflex muscle tone and strengthens your ability to get up from a chair and walking around the room. Sense of sight and hearing, coordination, balance, laboratory test, blood test can help your doctor rule out other possible causes of memory loss and confusion, such as thyroid disease or vitamin deficiency. Conclusion. Although the disease cannot be completely avoided, but we can prolong our well-being and prevent it from affecting us at an early age, taking the steps that the scientific community recommends and taking care of ourselves. Finishing, this has been our presentation and we hope you liked it. Thank you for your attention.